Hi, my name's Mariah. I'm going to be your nurse today. I'm going to start by assessing your cardiac system, all right?
Mm-hmm.
All right, so first I want you to lie on your right side and unbutton your shirt to about here. I'm going to start by doing the carotid arteries and auscultating those. All right, so when I do this, I want you to hold your breath. Ready? Hold your breath. All right, you can take a deep breath now. All right, and next I'm going to be doing, looking at your precordium, sorry. So you want to note that his skin is the correct color for his ethnicity. His hair distribution is normal. His chest symmetry seems to be, his chest seems to be symmetrical, and there doesn't seem to be any problem with him getting a deep breath, so he doesn't have any heavy breaths or anything like that. So I'm going to start by palpating the different areas in your chest, and I'm going to be doing the aortic area, the pulmonic area, Erb's point, and the mitral and the tricuspid valve. Is that all right?
Mm-hmm.
All right, so you want to start with doing the aortic area, and then the pulmonic area, and then the Erb's point is just below that, and you would be trying to feel for like the artery area. And then tricuspid. All right, and then when you feel for the apical pulse, you want to go in between the fifth and sixth rib, and that's usually right under the breast area. All right, and for all of the arteries, if you can feel the pulse, it should be about a 2+ grading system. And now I'm going to be listening. I'm going to be auscultating with my stethoscope those areas. And then you want to do underneath for the apical pulse area. All right, that all sounds good. And now I'm going to ask you to sit up so I can assess you for any heart murmurs.
Okay.
So can I have you sit up? And when you're assessing for heart murmurs, you want to do it when they're sitting up and then when they're laying on their left side as well. So I'm going to be using the bell side of the stethoscope for that. And you want to be listening for any whooshing sounds or any abnormal heart sounds. And the apical pulse as well. All right, now I want you to lay on your left side so I can do it on that when you're laying on your left side as well, please. And I don't seem to be hearing any abnormal heart sounds or whooshing, which is a good thing. All right, everything sounds good, so you can button up your shirt now. And next I'm going to be doing the upper and the lower extremities. So I'm going to start by looking at your arms, and you want to note that on the upper extremities that his skin seems to be appropriate for ethnicity, his hair distribution is appropriate for his gender, his skin is warm to the touch, and there aren't any visible lesions that I can see that are concerning, and he also seems the moisture of his skin is not too dry and not too oily. It seems to be pretty good. So I'm going to start by doing the radial and ulnar pulses of both of your extremities. You want to feel about a 2+ grade pulse, which is what I'm feeling. All right, and next I'm going to be doing the capillary refill in your hands. And that should be it should take about 2 seconds for the color to come back to the fingernail. All right, and then I'm going to be palpating your epitrochlear node, which is on the inside of your elbow, and you shouldn't feel any distension of the node. It should be pretty flat, and because if there's a distension, there might be a lymphatic issue there. So I'm going to do that on both arms. All right. And next I'm going to be doing your lower extremity. So can I have you sit with your legs kind of this way? Yeah. Thank you. So again, I want to note the color of his skin, which is appropriate for ethnicity, the hair distribution, which is appropriate for gender. He seems to have one lesion on his knee, but that it's a scar, so it doesn't seem to be of any concern. And again, his skin is warm to touch, and the moisture of his skin is pretty normal. It doesn't seem to be too dry or too oily. So first I'm going to start by palpating some of your arteries. So I'm gonna do the femoral artery, which is on the inside of the thigh. And while you're up here, you also kind of want to be feeling for any of the inguinal nodes. But again, if you can feel the femoral artery, you want it to be 2+ grading. I'm going to do it on both of your legs. And you use 2 fingers when you're palpating for the arteries. And you also want to feel for any inguinal nodes, which I don't seem to be feeling, which is a good thing. Next, I'm going to be doing your popliteal pulse, which is behind the knee. Okay. I'm going to do it on both of them. Alrighty, and now I'm going to be doing the pulses on the feet, which are on the top of the foot and on the inside. So again, you want to be feeling the 2+ pulse. All right, and last but not least, first I'm going to be doing the capillary refill on the toes. And again, it should be like a 2-second refill period, which it seems to be, which is normal. And then last but not least, we're going to be doing assessing for edema. So when you assess for edema, you want to do the top of the shin, the top of the foot, and the back of the heel. So you're going to be pressing in for 5 seconds. And then letting go and seeing if there's any indentation left in the skin. And there doesn't seem to be any indentations, which is a good thing. And then we're going to do the shin. Good. And then we do this one. All right, the shin. The back of the heel. And there doesn't seem to be any, his skin doesn't seem to be staying indented, and there's no redness or swelling, so I don't think that he has any issues with edema. So thank you for letting me assess you today. Have a good day.